Hi, my name is Lindsay Pristou, and I will be talking about the mechanism of action of Piclamilast. Piclamilast has a molecular weight of 381.2 grams per mole. It has 5 retainable bonds, 4 hydrogen bond acceptors, and 1 hydrogen bond donor. It is very similar to roflumilast, which will be discussed later. Piclamilast is a monocarboxylic amide, which is formed by the condensation reaction of the carboxy group 3 cyclopentyloxy 4-methoxybenzoic acid, seen in the up right-hand corner, with the amino group 3,5-dichloropyridine 4-amine, seen in the lower right-hand corner. Most importantly, piclamilast acts as a phosphodiesterase 4 inhibitor, commonly referred to as PDE4, and this PDE4 inhibitor blocks the degradation of PDE4 on CAMP, cyclic adenosine monophosphate, and this is very important regarding inflammation and will be talked about at length much later. Piclamilast also acts as an anti-asthmatic drug, an anti-inflammatory agent, as well as a bronchodilator agent, and these all go hand in hand and are very important to consider what diseases and conditions this drug will be most appropriately suited for. And from these functions, we can clearly see that this drug would be useful for diseases that would primarily affect the immune system as well as the central nervous system. These diseases include COPD, asthma, rheumatoid arthritis, eosinophilia, pulmonary eosinophilia, and much more. This figure utilizes roflumilast. However, all PDE4 inhibitors follow in the same way. Piclamilast utilizes selective inhibition of the 4 PDE4 isoforms, which are important for inflammatory immune cells. And among these immune cells, such as mast cells, neutrophils, macrophages, etc., PDE4 is the most common PDE. In structural cells, such as sensory nerves, PDE4 is also the most common PDE. So we can clearly see that it's evident that piclamilast will not only primarily target diseases and disorders that are tied to the immune system, like rheumatoid arthritis, but it will also target diseases of the central nervous system, potentially like traumatic brain injuries. In order to comprehend how this drug accomplishes these effects, one must know the mechanisms of action for piclamilast. Inhibition of PDE4 causes CAMP levels to increase in the body, and this is because PDE4 is inhibited and unable to hydrolyze CAMP, and this is an extremely important phase of this process. Since the presence of CAMP suppresses the immune system and in turn the inflammatory cells, the overall result is reduced inflammation as well as a suppressed immune system, making piclamilast an effective treatment option for diseases that are related to high inflammation and overreactive immunity. Reduced inflammatory response and immune response will have a systematic effect on the entire body, and this in turn leads to bronchodilation, or the expanding of bronchioles within the lungs for increased airflow, making this drug a fantastic anti-asthmatic drug. However, it may contribute to immunosuppression as it suppresses the immune system. After conducting extensive research, I found multiple studies that showed the positive treatment effects when using piclamilast on individuals with COPD, and the study that utilized in vitro results confirmed that the presence of PDE4 inhibitors inhibits the functional response of phagocytes with individuals with COPD. The results of this study also suggested that most of piclamilast inhibition occurs through intracellular elevation of CAMP, and additionally, the study followed previous study standards in yielding a maximal inhibitor of 70%. It also expressed the possibility of this drug being used to treat all obstructive airway diseases. However, there are many downfalls to this drug, the first being its unfavorable oral bioavailability. Oral bioavailability is defined as the fraction of an orally administered drug that reaches systemic circulation. Poor bioavailability leads to lower efficacy and increased inter-individual variability. This means that piclamilast could cause unpredicted effects in patients, and solely because of this, piclamilast was not able to advance into any further clinical trials. Consequently, there is not a large sample space of research that is related to clinical settings. It is important to note that because of this, many older research results regarding piclamilast may also be limited. The second downfall is piclamilast's adverse side effects. Aggressively vomiting and skin irritation are the most common side effects, and this follows the paradigm of all PDE4 inhibitors. and unfortunately, scientists have been unable to separate these effects while getting the same anti-inflammatory outcomes. While Piclamilast does achieve desired effects, its adverse side effects may be seen as intolerable. And with this in mind, it makes sense as to why medical physicians do not use this drug as commonly as other treatment options. Because all PDE4 inhibitors act in a similar fashion, we can draw the same conclusion to these as well. I couldn't help but question the effects a suppressed immune system would have on your body fighting infections. If these immune cells are not being recruited to the site of infection because of increased CAMP levels, your body will not be as effective in fighting off infection. Consequently, I would speculate that individuals taking this drug may have to stop taking it when faced with infection. Unfortunately, because Piclamilast was unable to break into more clinical trials, I was unable to find out if my speculation about immunosuppression was accurate. However, if you look at it solely from an immunological standpoint, it seems very likely that Piclamilast maybe need to be stopped if the patient is facing infection. In summation, Piclamilast acts as a PDE4 inhibitor. The inhibitor of PDE4 reverses PDE4 degradation on CAMP, resulting in increased CAMP levels. And when CAMP levels in the body are high, it suppresses the immune response, resulting in decreased inflammation, increased bronchodilation, as well as increased immunosuppression. The mechanisms in which Piclamilast works is very interesting. Using a drug that turns off the immune response can be very applicable for when you want reduced immune effects. While the drug's lack of oral bioavailability, as well as its adverse side effects, may have led to its ultimate fate in a clinical environment, the drug is continually used in research practices.